Good morning, everybody. This is Heather Thomas with the Joint Information Center for Snohomish County's COVID response. I'm going to take a moment to click buttons so that the media have permission to record. You will have permission to record this briefing, and we are also recording. The link to that video will be available on the Snohomish Health District's website later today. Give me just a moment. Okay, I think I've given everybody permission to record. If you have any issues, please send a message through the chat box to the Joint Information Center and I will get that fixed. We're joined here this morning with Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Fitters. Each of our speakers will be providing an update, and after they've spoken, we'll take questions using the chat feature. Please be sure to submit your questions to everyone so that all of our speakers can see. Thank you for joining us, and with that, I will turn it over to Executive Summers.
Well, thank you and good morning. Thanks for joining us again today. So as you might have either seen or heard, I proposed last week with the support of County Council Chair Wright and Vice Chair Dunn, 2 ordinances to provide hazard pay to county employees, some county employees, and grocery workers in stores with over 500 employees within Snohomish County and incorporated areas. These proposals would really ensure that those who've been on the front line of COVID-19 will earn supplemental pay. So as we all know, for the past 17 months, frontline county workers and employees of grocery stores have really ensured that essential government services and our food supply were uninterrupted, and did that at significant personal risk. So with the state's reopening coming in just over 2 weeks and a significant portion of the population still unvaccinated, these payments will help ensure these high-risk populations and positions have additional compensation for the hazards they face. The payments also help the county and large grocery stores retain employees at a time when the labor market is tightening and is very tight. I also think that by using federal ARPA funds, American Recovery Plan Act funds for county employees, we're helping provide some economic stimulus to our struggling businesses within the county. So if the proposed ordinances are approved by the county council, and frontline public-facing county employees will be provided a one-time payment of $1,250. And we believe there are approximately 1,500 of such county employees. Grocery workers in stores with more than 500 employees would earn $4 more per hour. The ordinances would end or terminate when the governor's emergency orders end, or December 31st, 2021. So we believe it's a balanced proposal to help our workers, provide some incentives for folks to stay in their jobs, give a little extra stimulus to our businesses that are still struggling. So again, the county council will be taking these matters up, and we'll have the ultimate say over whether those ordinances are accepted or not by the council and go into effect. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Thanks, Executive Summers, and good morning, everyone. So for the first time since mid-October, our rolling case rate, that 2-week total of cases per 100,000 residents, ending on Saturday, June 12th, fell below 80. For that period, it was 79 cases per 100,000 residents. The number of cases reported each week have dropped off significantly in recent weeks from a peak of up around over 1,000 cases per week at the top of wave 4. We're now down to just over 300 cases per week last week. That's been leveling out a little bit. So, we're hoping to make more progress in pushing rates down further. As we've said before, this is largely thanks to tens of thousands of people continuing to get vaccinated each week here in Snohomish County, approximately 25,000 having done so last week. Looking at data through June 12, we now have 55% of our population 12 and older fully vaccinated. And when you looked at a breakdown by age in Snohomish County, at the high end, we've got 80% of folks over 65 having started vaccination and 75% of them having completed it. That's fantastic. And there's still room for improvement, but that's a great accomplishment. At the low end, as we go down each decade in the age group, there's just a slight decrement in coverage. And at the lowest end, adolescents age 12 to 15, 33% had initiated vaccine through last Saturday and 17% had completed. Most in the adult age groups, 18 to 34, 35 to 49, they're all above 50% on having started and at or near or above 50% on having completed. So we're continuing to make progress, but there's still a ways to go. We want to continue to see these numbers going up as we get closer to the states reopening on or before June 30, as well as the July 4th weekend coming up. It's important to remember that unvaccinated individuals, as well as immunosuppressed individuals, regardless of their vaccination status, should continue to wear masks at public indoor settings and when outdoors, when social distancing cannot be maintained. According to projections published last week in Lancet Infectious Diseases Journal, modeling showed that relaxing social distancing measures for vaccinated individuals should have minimal impact on COVID incidence, but extending such guidelines to other individuals could fuel a rapid rise in COVID-19 cases, hospitalizations, and deaths. If pre-pandemic activity resumes among the entire population, we should expect another surge, albeit with fewer hospitalizations and deaths due to the high vaccination coverage among the most vulnerable elderly adults. The authors urged a cautious approach in the coming months, especially given the emergence of highly transmissible COVID variants. It's also important to remember that if an unvaccinated person is potentially exposed to someone with COVID-19, they still will need to wait out the full quarantine period at home. So again, in public, if you're unvaccinated, indoors, wear a mask, even after June 30. And getting vaccinated allows you to shed the mask in most, but not all settings. We got to remember things like healthcare, schools, jails, public transportation. Everybody still needs to wear masks until further notice. And we can all bypass quarantine if exposed, if we're vaccinated. So these are all motivating factors for those of us who haven't yet been vaccinated to do so. So in summary, we're making great progress, but we still have about 250,000 eligible adults and adolescents that need to go get vaccinated in Snohomish County. We're continuing to get out into the community with clinics, and vaccines are widely available at pharmacies and other healthcare settings. So it's time to take your shot so we can continue moving Snohomish County forward and doing so safely and successfully and sustainably. Parents and guardians of school-aged children should also remember to schedule a well-child visit and catch up on other vaccinations before school starts up again in the fall. You've got 3 months to do that, but it's, often getting those appointments is a challenge because everyone else is trying. So even though it's several months off, I'd say call this week to make that appointment. In non-COVID news, I'd like to do a quick reminder about bats and rabies exposures. Keeping in mind that human rabies is extremely rare, but when it does occur in the United States, it's almost always a bat variant acquired from a bat. With the warmer weather and people doing spring and summer cleaning, we've seen an uptick in bat encounters. Most bats are harmless, but it's important to remember that 1% of bats in the wild and about 5 to 10% of bats that come into contacts with humans are infected. It's higher in bats that come into contact with humans simply because normal bats don't seek human contact. And so there's a higher probability of something being wrong with them if they're coming in contact with humans. and hence the higher positivity rate for rabies in them. So while we have had no cases of rabies in Snohomish County in recent years, each year our communicable disease program provides consultation to countless healthcare providers on dozens of potential rabies exposures in Snohomish County residents, particularly with respect to human contact with bats. Our role is to determine if there has been a true risk of rabies exposure, and if so, is testing of the involved animal indicated, and or is post-exposure immunoprophylaxis, that is vaccination of the exposed person, indicated. The actual carrying out of that is done by the healthcare provider. Examples of a potential exposure to a bat would include an overt bite or a scratch from a bat, finding a bat in a room when waking up, finding a bat in a room with an unattended small child or someone who is immobile, intoxicated, or mentally incapacitated, or reaching into a blind space with a bare hand and having contact with a bat, or having a bat fly into you and hit your bare skin. Remembering that the teeth and claws of bats are so small and so sharp that unrecognized bites and scratches can occur. So this is an important reminder to make sure your pets are up to date on their rabies vaccine, especially if they're outdoor animals, to avoid them acquiring the rabies virus from bats or other animals. If you believe your pet has been exposed to a bat, please contact your veterinarian for further assessment. If you have been exposed to a bite or scratch or really had any contact with a bat, please contact your primary care provider or go to an urgent care center to have the exposure evaluated and to get appropriate medical attention. It's important to remember that if you do have contact with a bat and we are able to test the bat, that's helpful. We would never want anyone to risk having more contact with the bat in order to save it. But if you can stick a box or a jar or something over on top of it to secure it, that will allow it to be tested and could help in the management of the exposure. Your healthcare provider should contact the health district if there's any suspicion of rabies exposure to talk over these matters. And again, don't release or throw out a bat if you can safely contain it in some type of box or such. And likewise, if your pet has come in contact with one of them. When you try to handle a bat, to secure it, to get it into a box or to get it out of your home, make sure you're wearing thick gloves and have full covering of all your skin so that you don't have any bare skin contact with a bat, be it dead or alive. And again, they should be placed in a box, and then you can call the health district to talk over the situation and get further instruction. Again, above all, try to avoid all contact with bats and never pick up or reach toward one with bare hands. For more information on bat safety, you can visit our website at www.snohd.org/bats. So with that, I'll turn it back over to you, Executive Summers.
Thank you, Doctor. First question's for you. Curious about your thoughts on the circulating Delta variant of COVID, and are you at all concerned about it?
Yeah, well, certainly, it is circulating in the world. It's was originally, and I'm still learning. I'm still committing the new nomenclature to memory. So the Delta is the strain that was first detected in India, formerly or concurrently known as B.1.617. It's got many of the same mutations as the B.117, B.351, P1. It's in that category of antibodies acquired from immunization and prior illness aren't quite as powerful in neutralizing it in the test tube. However, in the community, in the places where there have been cases, there doesn't seem to be a significant decrement in the vaccine's ability to prevent severe disease, hospitalization. So we're still okay there. And we have had cases detected through surveillance in Washington State, and a handful, I think there's 9 of them that have been detected in Snohomish County. Remember, that's just from a sample, about a roughly 10% sample of positives that get typed. So again, I would just circle back around to the larger variants of concern issue as one reason for us to, in public health and medicine, to maintain vigilance for emergence of strains that might be less susceptible to our immunity acquired from vaccination, greater severity, greater transmission. But this doesn't seem to be breaking away from the pack of other variants of concern in any way. But by definition, it is of concern, and we'll continue to watch it.
Last week when we were asked, we said we hadn't noticed any increase in vaccinations or rate since the state announced the vaccine lottery system. And now that the first drawing is complete and the second one is happening today, apparently, have we noticed any increase in vaccination numbers?
No, I'm not aware of any. I think looking at the 4 weeks ago, 3 weeks ago, 2 weeks ago, total vaccination numbers were 30,000, 27,000, 25,000, if my memory is correct, with a roughly 2-to-1 ratio on dose 2 to dose 1. And that's where we're at.
So we are still seeing substantial numbers of people getting vaccinated, but it's not the surge we had early on.
Yeah, that's right. And it's important to, that with any effort, early on, we got all the low-hanging fruit, and now we're trying to reach the harder to reach people who are hesitant, less available to go to mass clinics, busier. And so naturally those numbers come down, but we're still vaccinated 25,000 people last week. So, that's, that we want to see that continue.
Okay, next question. The state vaccination rate for 16 plus years old above initiating vaccinations appears to be 67.3%, including federal numbers. Would you be in favor of the governor fully reopening the state right now, considering the possibility that the lag time means we've already reached the governor's goal of 70%?
Well, I'm not in the business of making recommendations to the governor. I think that we are where we're at. He and his advisors set that threshold, and it's really theirs to decide when to launch or to just wait it out until June 30. I abstain from that.
Okay, let's see here. With folks yet to be vaccinated, do you think access to doses or hesitancy remains the biggest challenge? And how important are the community-based clinics to boosting access? And are there any new plans to try and reach those hesitant for a dose?
Well, as I just mentioned, we're now in a phase. Sometimes in these kind of efforts, we call it mopping up. I don't know that we're that far along, but the notion, as I said, of the high return, high yield efficiency mass clinics, and we've kind of exhausted that. That's why we're scaling down the mass clinics, and so now it's that basically 2 venues. One is individual level healthcare provider patient, talking it over and, making a choice, people showing up at pharmacies to get vaccinated. And then, of course, we for the time being, at least, we're continuing these community-focused or mobile vaccine clinics that, target trying to get 100 to 200 folks done. We've been reaching about 50% of that target. When we set up a clinic for 200, sometimes it's only 75 or 100 that show up. But, piece by piece, that's helping at an individual and at a micro community level us to continue furthering coverage of the vaccine. Got to be honest, on the macro level, 75, 100 people. Very important for them and the people around them, but that's a tiny, tiny increment. And so what we really want to have happening is not only that activity to lower barriers for folks that really have trouble with access, but we really need, everybody that is able to kind of make that effort, go to the pharmacy, contact the primary care provider, try to get in and get vaccinated. And we need all that happening to really continue this effort at completing the initial emergency vaccination.
Yeah, I would just say the community-based clinics are really an important tool, just like the lottery is. But they really do reach groups of people that just might not otherwise get a vaccination. They're around people they know, people they trust, and that'll build on itself too as we get folks vaccinated. Hopefully more and more people around them will feel comfortable doing it. So it's just a slow job. It's just not the huge wave we saw early on with all the people that wanted badly to get vaccinated. But it's the ground game, and we're going to keep doing it. The same with the lottery. I'm sure that there's people that did initiate because of lottery, but again, it's not a mass surge of folks. So all these tools help, and we'll continue doing them for the foreseeable future. We're not through this yet. I saw that England is pausing their kind of reopening date because of a surge there, and we have to be cautious about the same thing. So we'll keep going and reach out to everybody as much as we can and assure them that the vaccine's safe and effective, and just continue all the tools we have. A question about, has the health district been in touch with Department of Health about the statewide number of people 16 and older with one dose? If so, what are they saying? Ever since the inclusion of federal numbers, it's been harder to pin down an official number.
Yeah, right. And we kind of answered that already, but I think the gist of it is, we view our primary mission as in supporting the vaccination rollout effort and the prevention activities that still need to occur, especially by unvaccinated individuals in public settings. And that's really our main goal, again, sort of, drawing the 70% line and getting into it with the state over whether we're 67 or 71 or 69 is not, that's not, I think, what we're here to do. We're here to make sure vaccine gets rolled out, and then we leave to the policymakers the policymaking.
Great. That all the questions we have in the chat box. Any other questions? Last chance.
Okay. This is Heather Thomas with the Joint Information Center. We're going to go ahead and wrap up for today, but please stay tuned for future media availabilities. Thanks and have a great day.
Thank you.